Hello, my name is Barbara Lauer and together with my colleague Kimberly Bruce, I lead Year 4 for Primary Care. Welcome to this short presentation. It is intended for GPs who are new to Year 4 teaching. In this talk, I will cover what GP4 PCC is, its structure, building blocks, what students need to do, what your role as a GP teacher is, a little bit about assessment, and also some recent student feedback. GP4 PCC is our new course for Primary Care Year 4. We changed this as part of MB21, the new Bristol undergraduate curriculum. GP4 is a longitudinal integrated clerkship. This means that it will be threaded through the secondary care placements all through the academic year. We will be sending students to your practice every Wednesday. Students will have 2 GP placements, 18 Wednesdays in one GP practice in one academy, and then change academy and also change to their second practice. The primary care placements alongside primary care are either complex medicine for older people for 18 weeks, or they will rotate through child health, mental health, and reproductive health and care of the newborn. They will have 6 weeks in each one of those. We have 2 GP placements, and together they make up one GP4 PCC clerkship. This means that the learning outcomes for GP4 will need to be achieved over the year. This slide gives a brief schematic of the organization of the Wednesday. We would like students to have a check-in and a check-out on the Wednesday. That's really to get orientated in the morning, to say hello and know what their timetable is going to be. And the checkout is to check that your students are okay and to debrief them on anything that may potentially have concerned them, or particularly whether they have concerns about a patient maybe. This will keep students and patients safe. Sometime in the middle of the day, we would like you to have further contact with your students, either for tutorial or in those weeks when there isn't a tutorial, to practice consultation skills with students role-playing the scenarios that we have created. In the check-in and the check-out, we would like you to briefly touch on the skill or drug of the week. We have developed these concepts of skill and drug of the week to ensure that students have consistent learning between academies. GP4 is made up of different elements which we're calling building blocks. We're calling them building blocks because they can be moved around according to what suits you and your practice. As in MB16, it's really important for students to have patient contact. That is really the essence of this course, and the more patient contact they can have, the better. We would like students to conduct consultations themselves, ideally at least one consultation by themselves each Wednesday, and more would be really great. Students should have time for self-directed learning, either reading up on things they've seen in surgery, on preparing for tutorials, following up with their assigned patients, working on the micro-project. We've already mentioned tutorials and consultation skills practice. We would also like students to have contact with other members of your team within the practice. So, for example, receptionist, practice manager, treatment room nurse, nurse practitioner. You may have a practice pharmacist. You may have a social prescriber working in the practice. We would also like them to have contact with allied health, the health visitor, midwife, and others, district nurse obviously, and others who are working in your surgery. Some surgeries may have a drug counsellor, and it would be beneficial for students to have time with them. We would like students to carry out authentic tasks. By this we mean activities that need to be done for a patient anyway. So for example, phlebotomy, we would like students to be regularly involved in taking blood from patients. We would also like them to carry out health checks, for example, the routine checks that are needed for patients with learning difficulty. Students could also, for example, follow up patients who've been discharged after a COVID infection and check on how they're doing. To help you with this teaching, we have created a number of resources, including a teacher guide and a clinical diary for the students. You can find this on the primary care webpage, which is open access, and the link is on this slide. We've also put all the resources for GP teachers in the university platform called OneNote, and we will email a link to you. In addition to the GP and student guides, it will also have the complete information for tutorials, including answers. And it will have the master timetables for both placements and templates that the students need to complete. To help GPs and students with the planning of their teaching and learning, we are emailing both of you every week. GP teachers will have an email from us on a Wednesday. This will have the information for the following 2 Wednesdays and also a Microsoft attendance form. Please can you tell us whether your students attended or whether they missed a session. This means that you do not need to collect attendance information yourself, and we won't ask you at the end of the placement whether your students attended or not. This form is replacing that. We will also send a weekly email to your students. They will get their email on a Friday, and this will have information for the following week, including additional learning resources. And this will also include a link to the virtual videos, GP videos, which are released on a weekly basis. This slide is about getting ready for your students. You may have been through this process before with other parts of primary care teaching, or you may have had other learners in the practice. You need to consider which room or rooms the students are going to be in, what equipment they will need. It is very handy to put some equipment, some simple equipment together for them, including, for example, if you've got spare equipment, it would be helpful for them to have a blood pressure monitor and an oximeter. You also need to let the whole team know that the students are coming and when they will be coming. It can be helpful to put their names up in a prominent place. Maybe if you've got other learners in the practice as well, you've got a board where you keep teaching information. It can be really handy to put up an image of them as well. And you need to think about the timetable. So plan your first day and also subsequent timetables. Who will be involved in their teaching? Who will they be sitting in with? And what information will your colleagues need? We're also asking students to prepare for coming to your practice. We will ask them to explore your practice website, and we've created a simple template directing them to the kind of information that they should be looking at. So for example, who is working in the practice, how patients can obtain a repeat prescription, and so on. It is helpful to invest a little bit more time in the first Teaching Wednesday. I'm sure you've got your own plan for this, how you're going to welcome the students, whether it's possible for them to meet practice staff, and what is possible in terms of showing them the surgery, because we do appreciate that during the pandemic this may be a little bit more limited than it might otherwise be. Also, it's useful to set ground rules and expectations. So for example, punctuality, being prepared for tutorials, and you might also want to give them information regarding PPE and COVID in the practice. You will have made a timetable for them which you will need to communicate. It is helpful to have a little bit of one-to-one time with each student to get to know them a little bit more and any concerns that they may potentially have. We will be asking students and GPs in the first placement to complete some simple information on a handover form, so you should be asking your students for this to have a look at that. We also find that observing students consulting is a really useful way of getting comprehensive information about their skills, knowledge and level of confidence. You can set this up as a mini-KEX and use the mini-KEX form for this as a guide, for example, for giving feedback, but please don't upload this into the student's portfolio. This is really just for practice and for you to get to know the students. You may also want to plan for other possible activities. So, for example, do you want them to carry out some practical skills, like, for example, phlebotomy? Would they be able to go out on visits with you or other members of staff? Could they have time with other members of staff, for example, in the treatment room? Could they contact their assigned patients? Students should have completed their micro-project during the first placement, but if they haven't done so, you might want to discuss a project that you have. And we've called it a micro-project because there isn't a lot of time for it, but we really just want students to have the opportunity to further develop their governance skills in, for example, quality assurance, like an audit, or leadership skills. They could, for example, run a health promotion session for that this could be virtual over Zoom for a group of patients or even your staff. A little bit more about tutorials. There will be 7 tutorials in this placement in total, and they will have had 7 tutorials in their first placement. Tutorials will alternate roughly with consultation skills practice, and as I said before, students are expected to role play these practice consultations. There will not be any tutorials when students have an academy afternoon. There are 2 academy afternoons, and there won't be any tutorials on the student review days. All resources for tutorials, drug of the week and skill of the week will be provided. Students are well used to case-based learning, which means they're given scenarios and questions that they then need to research the answers to. We're not giving the answers to students in their resources, and we're asking you not to share the resources that we give to you with the students. We do not want them to just sit and read the answers, because they gain so much more from researching that themselves. We would like tours to be run along the flipped classroom principle. Students should come prepared and should have found answers to the questions and the scenarios that we have said. So tutorial time is really for them to have a discussion with the GP for deeper and active learning, clarification of questions and any misunderstandings, and also potentially for applying what has been learned to real life scenarios. So you might want to contribute some scenarios from your own practice, maybe a different patient, maybe an older one, maybe a younger one, maybe one who's a bit more complex. How would they apply their knowledge in somebody who's got other issues as well? It is not your role to impart straightforward factual knowledge. It's the role of the student to find that out prior to the tutorial. So, what will your students bring to this placement? Students have extensive experience in case-based learning and finding things out, so they shouldn't have any problems to get prepared for the tutorials and the drug of the week. They will have missed a significant amount of clinical skills in Year 3, as they were pulled out of clinical placements at the end of March and didn't see patient again till the beginning of September. But they should have made up for some of this shortfall in their first GP placement and secondary care placements. Confidentiality is always uppermost in everybody's mind. Students have signed a primary care confidentiality agreement and a sample is in the GP guide. They've also signed a DBS statement in September and have had a full DBS check in year 1. Students will have undergone mandatory training in e-learning for health. They've completed 12 modules, which included some information on infection control and COVID and chaperoning. This slide gives you a full list of the mandatory training modules that they have completed. I won't dwell on this. So what do students need to do in order to satisfactorily complete their GP4 clerkship? They need to demonstrate satisfactory attendance and engagement. What do we mean by that? Students are expected to show 100% attendance for their GP Wednesdays and have to attend a minimum of 80% in order to pass it. Engagement is to be assessed by you as their teacher, and to help with that, we're asking students to keep a clinical diary. In this clinical diary, students are meant to track the activities that they are completing. We have given students a list of things that they must complete in order to satisfactorily pass this clerkship. There are 4 review points at which you and the students need to have a discussion how the student is progressing, and where you also need to look at their clinical diary and what progress they're making with that. We're also asking you to carry out workplace-based assessments, mini-KEX and CBD. In the coming placement, over the 18 weeks that you will see your students, we're asking you to complete 1 mini-KEX and 1 CBD for each student. A little bit more about assessment. I've already mentioned that there are 4 review points, 2 in GP Placement 1 and 2 in GP Placement 2. At the first 3 review points, you're assessing progress against the clinical diary and from your experience with the student. At review point 4, you've got the responsibility to sign off the student's clerkship. Has the student completed all the tasks in the clinical diary? Has their attendance been satisfactory? In order to do this, an electronic review form has been created, and the same review form is being used in all clerkships primary care and the secondary care clerkships. This is an electronic form, and the student will call it up on either their phone or their laptop, and you need to tell the student what they need, which box to tick, and any free text that they need to write. When the student clicks Save, that will automatically go into the student's e-portfolio, which is called My Progress. The Year 4 admin team can then download all the reviews that have been done into a spreadsheet and present that at the exam board, which sits at regular intervals. We have been able to collect a little bit of student feedback at the recent Zoom session on the 16th of December. The most popular activity in primary care is for students to consult with patients themselves. And that's very similar to what students in MB16 used to say. So the more consultations students can carry out, either with you directly observing them, with them being in pairs observing each other, with them being by themselves with patients being debriefed by you, any of these would be incredibly welcome for the students. And the more you can manage to fit in, the better. Less popular were activities that are the responsibility of the student without input from the GP teacher, particularly the online consultation videos. It helps to motivate students and consolidate their learning if any activities they needed to prepare for, like for example a drug of the week and the tutorial, is being debriefed by you, even if at times that may be quite brief, or asking them questions about it, or asking them questions about something that they did several weeks earlier. It really just encourages them to engage with the learning materials. With this question, we provided ready-made statements, and it's very encouraging to see that so many students actually said more positive things than negative things, felt more positive about primary care than negative. What we can take from this response is how important the GP teacher is and how much they value the time that the GP teacher gives them. So we're extremely grateful to everybody who's contributed already this year. So in summary, the more patient contact students can have, the better, and that includes remote consulting as well via Accurix or telephone consultations, because as you know from yourself, we do learn from doing, and working with patients and managing patient consultations is at the key of what we as doctors do and what students need to learn. And also the continuity of tutor, patients and practice, I think, is really important for students. So we all of us in primary care would like to thank you for putting yourselves forward to taking on this new teaching task after Christmas, and we hope that you found this useful. More information is in the guide, and also please email PHC if you want a further discussion or have specific questions, and we can then arrange to perhaps talk with you individually and answer your question on a one-by-one basis as well. Thank you for listening.